Hi, class. We're going to start with a review lecture for, chapter 3. You guys be sure to watch this and study. Your exam will be on tomorrow. So let's talk about what an EKG is. Your EKG is a recording of electrical activity of the heart via way of electrodes. Okay, so we're going to lead morphology and placement. Our objectives for this chapter was to define electrodes, name the bipolar leads and state the limbs that comprise them, name the unipolar augmented leads, explain what augmentation does to the EKG, explain Einthoven's law, draw and label Einthoven's law, even Einthoven's triangle, I'm sorry. Name the leads comprising the hexaaxle diagram, describe the location of the precordial lead, and name the two leads most commonly used for continuous monitoring in the hospital. Okay, objectives continue. Explain the electrocardiographic truth and describe the normal QRS complex deflections in each of the 12 lead EKGs. Okay, so what are electrodes? Electrodes are your adhesive patches that are attached to the skin to receive the electrical signals from the heart. This is an example of a pack of electrodes. You may see different forms of electrodes. There are a number of different ones that, so the ones at a particular facility that you're at may not look like these per se, but it usually says on the pack that they're EKG electrodes. Okay. So let's talk about our bipolar limb leads. And your bipolar leads record the voltage between electrodes placed on the wrist and leg. Your right leg is your ground leg. Lead 1 records between the right arm and the left arm. Lead 2 records the right arm and the left leg. Lead 3 records the left arm and the left leg. Okay. Here's just another example diagram of our little stick people here that shows the positive and negative lead and which way the current is traveling. Okay. Now your augmented leads are another set of leads which we will talk about with Einthoven's triangle. They are your AVR, AVL, and AVF. So your class. Your 6-limb leads Okay, guys. Sorry about that. So back to our lecture. Our 6-limb leads for the standard EKG shows our bipolar limb leads plus our augmented leads, and that gives us our 6 intersecting limb leads on the standard EKG. So if you'll notice with your EKG, if anybody has actually hooked up an EKG yet, you probably noticed that you only had 10 leads, and you'll get those other leads from you don't actually have leads per se, but the leads that are on show the different angles with your augmented leads, your AVR, AVF, and AVL. Okay. So here's the Einthoven's triangle, and it looks at lead 1, lead 2, and lead 3. Now, Willem Einthoven won the Nobel Peace Prize in 1924 for inventing the EKG machine. Okay. Here's another picture of Einthoven's triangle. These three leads together compose Einthoven's triangle. They are the bipolar leads. Each lead has a positive and a negative pole, and these leads are called indirect because they are more than 1 to cardiac diameters on the heart. Leads 1, 2, and 3 are indirect bipolar leads. Okay, so when we're talking about lead placement, we are looking at the lead placement recommended by the American Heart Association. That's what the AHA stands for. So that is where our lead placement markings are recommended by the American Heart Association. Okay. So let's look at our precordial leads, which are our chest electrodes. We have V1, which is located in the fourth intercostal space, right of the sternum. V2 in the fourth intercostal space on the left of the sternum. V3 between V2 and V4. Now, when you're hooking your patient up, you're going to hook up your V1, V2, and then you're going to move down and hook up your V4, and then you're going to come back and hook V3 right in the middle of V2 and V4. Okay. V4 is then in your fifth intercostal space, and it's left of the can't say that word today, clavicular line, okay? V5 has the same height as V4, but it's on the left anterior axillary line. And then your V6 is also the same height as V4, but it's going to be right under that armpit, okay, in the left mid axillary line. Here's just another diagram showing you the placement of the leads. Now, here you may see leads placed like this if you're looking at somebody with continuous monitoring on. However, for the sake of our class, this is our lead placement that you guys would be placing in lab on your EKG. Okay, here is another diagram showing you the travel of the current on lead 1, 2, and 3, as well as AVR, AVL, and AVS. Now, if you were looking at a 12-lead EKG, here's where you would be getting your leads from, okay? So remember we said leads 1, 2, and 3, AVR and AVL and AVF comprise your limb leads, and that makes up 6 views of the heart. And then your precordial leads, your V1 through V6, make up the other 6. So that gives you 12 views of the heart, okay? Now, hospitalized patients that require continuous EKG monitoring are attached to either a 3-lead or a 5-lead EKG. So they won't have a full 10 leads. And so they will be on what's called telemetry, okay? If you've ever been in a hospital, there's usually a whole wing that is just what's called the telemetry floor, okay? And you notice someone will be sitting at the nurse's station called your telemetry tech, where they will be watching all the monitors of the patient. Okay. The most commonly used lead on continuous monitoring is lead 2, and it's the most commonly used lead because it provides that excellent view of both the atrial activity as well as the ventricular activity, which corresponds with your P waves and your QRS complex. Now here's a little mnemonic to help remember how to place those leads for continuous monitoring, and it's salt, pepper, and ketchup. So your negative lead is your salt, your grounded lead is your pepper, and then you can't see that other lead down there, but the red indicates the ketchup. Okay. So common lead misplacement and why lead placement is so important. Okay, it is extremely important to know the exact placement of the electrodes on the patient because incorrect placement can lead to a false diagnosis of infarct or a heart attack, okay, or negative changes on the EKG machine. Okay, it's also important that an EKG is recorded accurately because EKG electrode placement is standardized, allowing for recording of an accurate trace, but also ensuring the compatibility between records taken at different times. So, what that means is if you take an EKG of a patient and you don't place those electrodes in the right place initially, that may be that patient's first EKG, which will be used by that doctor uh, and nurse as their baseline EKG. So when you go to run when that patient comes in or gets a second EKG, it's going to be look totally different if those leads weren't placed in the right place, okay? Because the leads are supposed to be in the same place every time, okay? So let's talk about some of the risks and complications as well as preparation for the patient getting an EKG. So we'll start with the preparation. There's no special preparation required prior to the test. The person can eat or drink before the test as per their daily routine, okay? You'll want to ask them or they'll want to let their doctor know what medications they're on and if they're allergic to any of the adhesive tape or lubricating gel. Latex allergy is a big um, factor. So you will want to ask them if they're allergic to any rubber or latex. Okay. Sometimes gloves will cause um, people who are highly sensitive to latex will cause them to have a really bad allergic reaction. The upper clothing needs to be removed. So it is advisable for the patient to wear loose, comfortable top or shirt. For women, wearing a separate top with trousers or a skirt can allow easy access to the chest. And then some of the risks or complications, it's a non-invasive procedure, so there aren't any physical risks. There are no side effects from the scan, although, like we talked about, the patient may feel cold with the gel, or again, you want to find out about any allergies. Okay. And here is just a slide showing the placement of electrodes. And remember I said the electrodes may look different depending on what facility you're at. So here's the one that looks different. And here's the type that we have here at the school. Now your skin prep is very important so that those electrodes stick properly, okay? Um, the skin should be dry, hairless, and oil-free. Shaved hair that can possibly impede electrode placement. Electrodes should have full contact with the patient's skin. For better electrode adhesion, an oil-free skin rub the area with an alcohol prep pad or gauze pad with benzoin tincture. Okay, and your facilities will usually have this present. Reduce electrical resistance minus the skin redness with 5 to 10 gentle strokes. This will help ensure that the heart's electrical signals are transmitted to the electrodes, and then you'll want to promote an environment that prevents the patient from sweating profusely. Okay, so here we see our cartoon up here. It says, "Don't worry, Mr. Smith. I used the shears on." Oops, sorry about that. Get back to it. On sheep on my parents' farm when I was little. Okay, and then here you see the hairy chest versus the chest that is smooth or has is freshly shaven. Here again are some samples of those skin preps that you may see in the facility here, and also showing you how to prepare the skin with your trimmer. Okay, on this side we have our Beethoven's triangle again. In addition to it showing you here in the little block what that QRS complex will look like coming from each of these leads. Okay, that will help you when you get to the point of identifying your strips and looking for any blocks or heart attacks or anything like that. Okay, so that's just general information for you guys to take a look at so you get an idea of what is actually going on the EKG strip. Okay, here is just another view of uh, these leads, this precordial leads, and the view of the heart that it gives, along with the leads 1, 2, and 3, and your AVL, AVR, and AVF. A lead is a glimpse of the electrical activity of the heart from a particular angle. Put simply, a lead is like a perspective. In the 12 lead ECG, there are 10 electrodes providing 12 perspectives of the heart's activity using different angles through two electrical planes, your vertical plane and your horizontal plane. Okay? Your vertical plane or your frontal leads, by using 4 limb electrodes, you get 6 frontal leads that provide information about the heart's vertical plane. Okay, and that's your lead 1, 2, 3, and your augmented vector leads, your AVR, AVL, and AVF. Now in the horizontal plane, that's where your precordial leads view, and that's your transverse leads, which are your 6 chest electrodes, okay, V1 through V6. Here's just another look at those, and again, a little diagram of what that QRS complex will look like coming from those different leads. Okay, here's the hexaaxle reference system, in which it gives you the degrees at which angle that current is traveling. These quadrants here, you see your thick line coming down the middle, will come into play when we get to the topic on reading the 12 lead EKG and having to determine the axis. Okay, so you won't have to worry so much about the degrees right now. Okay, but that's what your hexaaxle reference looks like. Okay, so what is a heartbeat? So with your heartbeat, this is what prints out on the EKG strip. Your P wave is atrial depolarization. Your QRS wave is your ventricular depolarization. And your T wave is your ventricular repolarization. Okay, and what that means is depolarization. Here you have your atria contracting with your P wave. And here with your QRS wave, you have your ventricles contracting. And then with your T wave, your ventricles are relaxing and the cycle repeats itself. Okay. This is another view of your limb lead placement. So why is the 12 lead EKG placement important? This is a big deal to me because I have on 2 occasions. This is a story that was shared by an EMT. And he says, this is a big deal to me because I have on 2 occasions moved someone else's 12 lead EKG placement and identified a STEMI that was not visible with the original placement. So you see right there why that placement is so important, because that patient could have actually had a heart attack. But if you didn't place those leads right, you won't be able to pick that up. On the flip side, recently I found a huge STEMI, and when I got to the main heart hospital, the tech took my leads, moved them down, and then you couldn't see the STEMI. Okay, so like I said, those leads are standardized. You need to know exactly where those leads should be placed and they should be placed there in those landmarks or those locations on the body every time. Because if you don't, again, you won't get an accurate image of the EKG. And remember, your doctors are making decisions about how to treat these patients based on the results of these EKGs. Okay. It's terrible patient care. He said these patients sit in the ER, in the emergency department for hours while they wait for their lab work to come back. Only then do they realize they're having a heart attack. Okay. A lot of times this could be avoided if the 12 lead was performed properly and the STEMI was identified on the first go round. STEMI, you guys, you'll learn more about when you get into myocardial infarction later on. In later modules, okay? It takes literally less than 30 seconds to find the correct position for 12 lead EKG placement. Now, what I've seen people probably in the past, guys, don't get used to just memorizing where you think that location is, okay? And based on memory, you just start sticking them there without actually taking the time to find the correct landmark, okay? And by the way, did you know that if your electrodes are off by 2 centimeters, that it can completely skew your EKG morphology? Okay, and so we know 2 centimeters is not big at all. Okay, your 12 lead EKG electrode placement explained. One of the most important questions related to the 12 lead EKG electrode placement is why are there only 10 electrodes? It's very important to understand what the term lead really means. A lead is a view of the electrical activity of the heart from a specific angle across the body. So even though you have only 10 leads, you're actually getting 12 views from different angles. Cables and sensors does a great job explaining more of the morphology and the vertical plane in the Entovin triangle. Okay, so remember we talked about your those first 6 leads. You have lead 1, 2, and 3, your AVL, AVR, and AVF. That gives you 6 views. And then your pre-quarter leads, your V1 through V6 gives you the other 6 views. So that's how you get your 12 lead EKG. Okay, electrode misplacement. Up to 50% of the cases have V1 and V2 in too high of a location, which can mimic an anterior MI or heart attack and cause T-wave inversion. Okay, and this is just an article. This article explains how to properly find the intercostal spaces and where to place the electrodes. Up to 33% of the cases have the prequartal electrodes V1 through V6 lower or laterally misplaced, which also leads to misdiagnosis. Okay, so remember I said do not try to just memorize about where the leads are. You need to actually familiarize yourself with finding those landmarks and those intercostal spaces. Okay, you guys can practice on. You can practice on a child or you can practice on an adult. Now it might be, you need to practice both on men and women so that you get a different view, okay? A different feel because of the women's breast, okay? You do not want to put those leads on top of the breast, so you will have to, go underneath and actually feel for those spaces, okay? Best practices for your 12 lead EKG placement, counting the intercostal spaces. When counting down to the 4th intercostal, it is helpful to know that the first intercostal space is the space right below the clavicle. Okay, so that first intercostal space is right here. Okay, and then you'll start counting 2, 3, 4, 5. Clean surfaces for our patients who seem adverse to hygiene. It is important to clean the surface of dead tissue to get an accurate EKG reading. You can do this by taking a 4x4 of gauze and aggressively rubbing the area until it is pink. Okay. The breast, oftentimes the 5th intercostal space is about the nipple line. On a guy, that's okay. It doesn't have to be below the breast, contrary to popular belief. Only for women with large breasts do we need to alter our placement and place the lead in the crest underneath the breast. This is because there's too much tissue to get a clear reading. Okay. And then look at trending. Trending, it is recommended to get a baseline before giving oxygen or other medication, and then performing multiple EKGs to see how the patient is trending. So remember, we talked about back in talking about why the lead placement is so important, and that is again because of that baseline EKG. When you go to that doctor is writing treatment based on these EKGs, so if you don't get, if you're not getting those electrodes in the right place where they're getting an accurate reading, that patient may need to be on oxygen, and the doctor may not order it based on the EKG, um, or any other medications. Okay. Remember, for example, that patient could have had a heart attack. Okay. So here again is another view of your EKG machine and lead placement. This is just a little caricature of where the lead shouldn't be. Okay, okay, again, another lead misplacement, and look at your strip. And here again, not properly prepping the skin. Uh, the nurse says he was doing fine before Shayna ripped the EKG patches off his chest and he went into cardiac arrest. So you can imagine if you've ever had tape or that Band-Aid or something stuck to hair on your arm or leg, you can, you've ever felt the sting from that. Imagine somebody who has chest hair, which is usually longer and thicker, uh, having to have that tape ripped off their chest. Okay, very painful. They will be upset with you, and you will not get a good report from them. Okay, so we're going to stop there. Guys, that's our review on lead placement. Okay, be sure to study your notes. Okay, you have a study guide posted. Complete your study guide and reread your chapter. All of this information that we went over on the PowerPoint is in your chapter, okay? So you will need to reread your chapter to get that information and to study, okay? And I will see you guys tomorrow. Bye-bye.